Begin by saying that I believe absolutely that at the end of the day, the only way this country is going to provide comprehensive, cost-effective health care for every man, woman, and child is through a single-payer program. And you all know the reasons for it, and you all know that we are the only nation in the industrialized world that does not guarantee health care for all people, and the cost-effective way to do that is to move the private insurance companies out of the process and the profiteering and the enormous administrative costs that we currently have. But that's not the subject for discussion today. I think we are more concerned about where we are. I think very clearly from the very beginning, this process of moving a health care bill has not been as efficient or effective as it might have been. I think that's one of the great understatements of the century. I think Max Baucus would be the first to admit it, and did admit it, that he made this mistake in saying at the very beginning that single pay was not on the table. And I think he regrets having said that, because what that sent was a message to the most progressive people in this country, that views that you hold very, very dearly, views that you believe are the only way we're going to achieve real health care reform in America, we're not even going to hear you. So I think there were other ways to deal with that issue, understanding that, frankly, we don't have the votes for a single-payer program. I tried to introduce single-payer legislation. My guess is we would have had 8 or 10 votes on that bill, and that's about it. And the House, there was nowhere near a majority. What should we do even right now? We have language in the bill that at least says that states that want to go forward with a single payer should be allowed to do that. I won't bore you with all of the incredibly complicated and bureaucratic hurdles that we've had to overcome. But bottom line is, as many of you know, California has already, I believe on 2 occasions, passed single payer to be vetoed by their governor. I believe that the way we will get single payer in this country is when one state, certainly a state like California, but even a state like Vermont, which has a strong single payer movement, when we do that and it works well, New York State, New Hampshire will be saying we want to do the same, and eventually you're going to have a national program. We have language in the bill right now. It is too weak. It does not give states the option to go forward until 2017. It was pushed back. As we speak, we're trying to get it pushed up to 2014. What about the process, about where we are right now? I think from the very beginning, the major error that Democrats undertook, the major error that existed, was the assumption that we had 60 votes or even 59 votes. And what should have been very clear from day one, you never had 60 votes. You never had 59 votes. I think we have 50 votes. Not 100% sure, but I think we have 50 votes to pass strong legislation, certainly including a public option. So I think what happened, and the question that we all have got to ask ourselves, is a year ago at this time, the American people were in amazement about a brilliant, charismatic guy named Barack Obama, who had run the best campaign in our lifetimes, elected president. Democrats gained more seats in the Senate. Democrats gained more seats in the House. A year later, we are in a very, very different place. How did that occur? And I think one of the reasons that it occurred is that we wasted month after month after month negotiating with people who are not interested in serious reform. So from day one, the understanding should have been, we got 50 votes, let's do it, let's move it quickly, let's take on the Republicans, let's rally the American people around a real strong health care bill. Well, it's only been a year, and apparently the White House now has that message. And we are going to go forward with reconciliation. But let me tell you something, and I think everybody in this room understands that when our Republican friends get on the floor, they say, reconciliation, it is undemocratic, it's just pushing things through, it's unfair. You all know that of the 22 times the reconciliation has been used since 1980, 16 of those 22 times were done by Republicans. And when people say, well, you can't get a comprehensive bill through, do not forget that the contract with America, a 2,400-page bill, which covered almost every aspect of American life, was passed by reconciliation, to be vetoed by Bill Clinton, thank God. They managed to get a broad bill through. So I think the understanding has got to be, I think we've got 50 votes to do something serious. Let's do it. I think the last point that I would make is I happen to believe that Obama ran the best campaign that I've seen in my lifetime. I think a mistake was made after the election that we forget about the grassroots in this country, we forget about the trade unionists, and we say to them, oh, we campaigned telling you that we were opposed to McCain's tax on your health care benefits, but by the way, we've changed our mind. That I think what we have got to re-engage in is a progressive, clear agenda. I think we've got to go out and rally the American people, once again get the young people involved that we had during that campaign. Once again, talk to our trade unionist friends, because we got to work on their issues. Talk to our senior friends who for the first time in 36 years are not getting a COLA, and engage the grassroots of this country in a significant political battle as we bring forward simple, straightforward, progressive legislation prepared to take on the big money interests that exist right here. The last point that I would make, this one has to be said, I know this is a healthcare issue, is the issue of Wall Street. You cannot underestimate how furious the American people are at the greed and recklessness of Wall Street, and how much they want us to take these guys on. And I think we lose faith with ordinary Americans when we have not yet done that. And that's an issue that we've got to deal with as well. So that's where I am. Thank you very much.